Hi, very good morning to all of you. Today we are going to discuss the case note of Mr. Brett Collister, who was under your care. He is a male patient in your general practitioner. This is the doctor's letter. It's a medicine letter. Of course, you can write it as a nurse practitioner too. So if you consider both professions, this case note can be written. Now let's go ahead with the case note. Mr. Brett Collister, who is a factory foreman, he is the patient here. Let's go directly to the writing task, what we have to write here. This is a referral letter. This is a referral letter to the endocrinologist. And you are requesting Dr. Grandly Cross, who is the endocrinologist here. So you're requesting Grandly Cross for the assessment and management of Mr. Brett Collister. So you're writing the letter to the consultant endocrinologist, City Hospital, Suite 32, 55 Main Road, Newtown. So that's it. So let's go ahead with the case note. Mr. Brett Collister is around 45 as per the date is given 2018. Now his height is 177 centimeter. He's a factory foreman, is married and 3 children. So he has hobbies like fishing, darts playing, watching football. Medical history, so he had a mononucleosis long ago, almost around 10 years ago. Now, when he first visited to your care, your clinic, whatever it is, it was on 22nd April 2017. That was the previous year. Now, right now, we have the year, 1 year passed. Right now, almost a year passed. So how he came first is cough and sore throat. So we have given him rest, plenty of fluid, salt water, gargles, left him. Again, he came after 2 months, again, sore throat. So it was, what we can say is that it was recurrent infections, that is throat infection means respiratory infections. So right now we have prescribed antibiotics. Now, 17th of August, September, he had a sore left shoulder while triggered by playing darts. So again, we have prescribed painkiller and we have gone with rest, ice compression and elevation. Now, 26 November, again, he had problems with the pain, sore right knee. By the time the shoulder pain has improved, again, we have prescribed pain medications and advised to reduce weight, exercise. Okay, so we have, if you see up to this point from 22nd April to 26 November, 4 visits. So all these 4 visits, he had multiple respiratory infections and multiple joint problems. So this was treated by us. Now the most recent visit, except it wasn't today, was on 4th of February. The patient feels tired, sore eyes, dizzy, sometimes for dizziness sometimes. And this, he reported it was for 3 to 4 weeks it persisted. So we have considered orthostatic hypertension. We suspected orthostatic hypertension. Overweight, he's overweight, his BMI is more, and he is not at all adjusting with the lifestyle, diet, and exercise, because he is telling that his work is too heavy. His BP is low, his weight is high, BMI is also high. What we have done is that he was sent back after ordering some blood tests for a review. When he came for the review on 24th, that's on today, you have found the diminished vision. The same conditions persisted. BP low, heart rate, all these things were same. We can see the test review. As per the blood investigation reports, he has a random blood glucose of 113.5 mmol. Yes, fasting glucose 7.4, HbA1c 8.5, and he has increased the cholesterol parameters. You can see all these things were increased. Now, results, all these results indicates type 2 diabetes mellitus, and therefore you are the endocrinologist was referred. So he was referred to the endocrinologist for the assessment. So 24, that's today, that's today's date. Dr. Grandly Cross, endocrinologist. You can say consultant endocrinologist or endocrinologist, both can be accepted. City Hospital, Suite 32, okay. So if it is consultant endocrinologist, you just go with that. So it's clear. Dear Dr. Cross, Dr. Reference Mr. Brett Collister, date of birth, all these things are clear. Now let's go with the purpose. I'm writing to refer Mr. Brett Collister, one of our clients who has type 2 diabetes mellitus as his preliminary diagnosis. He requires assessment and management at your service. So he is one of our clients. So I'm introducing this particular person, Brett Collister. He is one of our clients. He has type 2 diabetes mellitus as his preliminary diagnosis. He requires assessment and management at your service. So that's it. Simple. So this is a reference letter. So it's written refer who the person is, Brett Collister, and he is one of our clients. And what's his condition? His preliminary diagnosis is type 2 diabetes mellitus. He requires what? Assessment and management at your service. So Mr. Collister has been visiting our facility since 22 April 2017. This was his first visit. So 22 April 2017, he visited us first. Since then, he has been treated for recurrent attacks of upper respiratory tract infections and intermittent joint pains. So he has been treated since then for these two complaints. So this two sentences give you an idea what the patient is, how is what were the conditions for what he visited you the previous year. On 4th February 2018, he presented with complaints of tiredness, sore eyes, and dizziness, which persisted over the last 3 to 4 weeks. So this is the most recent visit, 4th February. So that's it. When we assessed, he had orthostatic hypertension and was overweight with a BMI of 29.7. Okay. When assessments revealed assessment revealed he was overweight with a BMI of 29.7, and he was and he had low blood pressure. Okay, so I can make it first. Assessments revealed that he and was overweight. Okay, so I can go with the vitals first and then with the weight. The BP first. Assessments revealed that he had low blood pressure and was overweight with a BP or with a BMI of 29.7. Okay, so that's it. So what we did is, in order to confirm his diagnosis, blood glucose and cholesterol examinations were ordered and was asked to come for the review. Okay. Okay. So in order to confirm his diagnosis, blood glucose and cholesterol examinations were ordered and was asked to come for the review with results. Okay. So I can say subsequently. Yes. Today, on review, Mr. Collister complained of diminished vision in addition to his previous issues. Today, that's on 24th, he complained of diminished vision. So he had some previous issues. Apart from that, he had diminished visions. His investigation results were as follows. Random blood glucose 113.5, it is. Fasting for 7.4, HbA 8.5, and elevated cholesterol levels, which indicated his preliminary diagnosis. So this results, so I highlighted the results as it is, and this indicated the preliminary diagnosis. What was this preliminary diagnosis? It's diabetes mellitus type 2. So who is Mr. Collister? I just need to give who is he and what is he? What is he? He's a fast factory foreman, and he has no adjustment to his lifestyle, diet, or exercise, for which he blames his busy work schedule. So he blames busy work schedule for this thing. He has no adjustment to lifestyle, diet, or exercise. Now, it would be appreciated if you could perform further evaluation and provide Mr. Collister the best treatment as you see the most appropriate. Please do not hesitate to contact me if you have any queries regarding Mr. Collister. Yours sincerely, as you know, that's the name is mentioned, so yours sincerely, doctor. So that is the end of this case note. What we have done is that we have briefed the visits and what is today's complaint that we have mentioned in the second paragraph, and then we requested the assessment and management to the endocrinologist, and this is the order we have organized. So thank you. Have a nice day.